First of all, I'm Aaron Miri, Senior Vice President, Chief Digital Information Officer for Baptist Health in Jacksonville, Florida. We basically serve the northeastern corridor of the state and the southern part of Georgia, both pediatric and adult. Been here over 65 years with about 14,000 team members and serving about 3.5 million people in this region. First of all, healthcare is under attack. Every single day, we're seeing in the news of a new healthcare system that's been affected by ransomware or some terrible, awful issue going on, and their data is affected. So to the degree of it, being able to standardize, streamline, protect, give yourself the ability to rapidly and agilely deliver that data wherever, whenever, at the point of care or on the beach if necessary, was critical for us. We have seen tremendous uptick in value from a clinical perspective, selecting IGEL. Let me give you a specific example. Our boot up time in the past was sometimes into multiple minutes, simply to get into the opening OS layer of Windows and saying, hello, now I'm broken into my applications. We brought it down to seconds. Specifically, what we have figured out is we've shaved enough time off of simply logging in because of IGEL that for every 200 physicians, that's over 17,000 minutes a day reclaimed to go back to the point of care. Do the math. Do the math of how much wasted time we took out of the entire process just for boot up, much less the security, resiliency, all the audit and control and logging, all the pieces that go into IGEL, the number of tools that we were using to back up operating systems, the data on operating system, your last known good backup and configuration. We're talking about probably a dozen or so tools running on top of each other, logging in on the system. And then all the time you're like, man, they just conflict with each other and you know something's gonna go haywire. It's inevitable. So what we did was simply say, okay, IGEL, what are the native tools there to restore? Could we restore from a USB key? Could we restore quickly on the go from a centralized monitoring and logging system? Yes and yes. So I was able to reduce the number of tools running on my endpoint simply because natively with IGEL, I get all this out of the box. Second thing, the number of teammates I had to have trained in numerous different technologies and disciplines, knowing that there's all different versions and variations and configurations, et cetera, and you're never going to be able to get an ideal state. It's just not going to happen when you have that much layered on a cake. I was able to simplify all of that, train them exactly how to manage with IGEL OS. Come on. That's a no-brainer. We're able to simplify the operating layer. We're able to simplify the application stack and simplify our ability for training on the go.
The CrowdStrike outage was horrific for all kinds of industries, not just healthcare. So we're in the middle of rolling out true virtual desktop initiative.
We have about 1,000 devices dispersed in some of our emergency departments. These are IGEL devices on the floor, leveraging the Microsoft Azure AVD stack on top of it. CrowdStrike happens, forcing everybody to work rapidly. So we said, okay, we have a mixture of IGEL devices in our emergency departments and a mixture of normal devices, which we know we could re-image quickly using the IGEL operating system. So we said, okay, let's just pull the trigger and go quickly and get these things back up and running. And it took minutes, if not seconds. My EDs that day were full to the brim with patients. They were able to be seen, no hiccups, and more importantly, not one patient saw the impact or felt the impact. My advice for other organizations or other CIOs listening, and this goes across all industries, not just healthcare, shift your dollars, your existing spend, to security by design vendors that understand out of the box the importance of having data restoration, access to systems, and immediacy to being able to overcome any bad days that occur. If you follow those principles and you're smart about your investments and you partner and ask the right questions, knowing what the currency is dealt with of your customers and your most valued crown jewels, you will have a winning solution. Favorite part of working with IGEL is the innovation aspect. It was interesting. It's been interesting as we go along. You find stuff all the time. Configurations are different, different types of keyboards that are out there and new drivers need to come up, USB pass redirection, working with Microsoft in partnership. IGEL's ability to be that intertwined disciplinary technology that helps make all this work and come together. It's like the secret sauce behind the whole soup, right? It's great. Microsoft is great by themselves. Device vendors are great by themselves, but you've got to have that middle layer that brings it all together, that magic sauce. That's what IGEL has been. For all of you listening at Disrupt Munich, know this from me. Healthcare thanks you. As we recently saw with the CrowdStrike outage, the ability to give that immediacy of response back to my patients who are walking into my emergency departments sick as a dog, meant the world to them, meant the world to my nurses, and meant the world to my doctors.
On behalf of healthcare, I thank you